So I just want everybody's opinion because, I feel like it's the responsible thing to do, but I keep getting told differently, I guess you could say. So, as many of you know, I currently have PSWs that come in to assist me with bathing. Now, like I said, Joe is positive for COVID. I'm still negative, thank goodness. Yes, he still takes me to my appointments, but he stays in the vehicle. I wear a mask, make sure to sanitize, all that stuff. Don't really have any other option, right? I do call ahead to the places that I have an appointment at and ask them, listen, I've been around somebody that's got COVID. Are you okay if I still come in? I will be wearing a mask and I will sanitize. So far, everybody said, yes, that's no problem. Now, the other thing that I do too is I've been letting my PSWs know, because I have 3 different ones that come in throughout the week. I was letting them know, listen, roommate's got COVID. I'm still in the clear. I just have a bad cough. But I can completely understand if you don't want to come into the home because there is COVID in the home, especially if you have other patients that are sickly or at high risk or anything like that. I want you to prioritize their care over me. I will make do. Whatever I have to do to make sure that I'm clean to the best of my ability. If I'm missing a shower, is what I have to do. Now, so far, haven't missed a shower because my one PSW that I have 3 times a week said that she doesn't have any patients that are compromised or elderly or high risk or anything like that. She said she also would just wear her mask and not bring in her coat or anything like that to just prevent anything, germs, I guess, attaching themselves to any of her belongings. So she ended up coming an extra day so far this week because my normal PSWs on Wednesdays does have a few patients that are sickly, as well as her own family that she wants to protect, of course. Now, when I call into the company that is my PSWs are through, I let them know, listen, there's COVID in the house. I'm still in the clear. My roommate's got it, and he can wear a mask or stay in the bedroom or whatever. But I just wanted to give the PS a heads up because I'm trying to be considerate and just let them know, listen, I understand if you don't want to come in because it is very contagious, right? And I get told, well, no, it's fine. They wear PPE and that's their job. I'm like, respectfully, I understand they're wearing PPE and I understand that this is their job. And I do understand that I guess some people wouldn't do this. But I would not be okay knowing, not that I would ever find out, but if I somehow found out that one of my PSWs came, picked up COVID, regardless if they actually became symptomatic or tested positive for it or whatever, but, passed it on to one of their other patients and then they got very, very sick, hospitalized, or worse, I would not be okay with that. I would feel absolutely horrible. And I feel like this is the proper thing to do. And this isn't the first time I've done it. So when I very first had a PSW in 2021, right after I had my very first surgery or procedure for the feeding tube, the same thing. In our household, we ended up with COVID. I think I actually had COVID at the time. I said, I have COVID. They shouldn't come in. And it was a different company at that time because Ontario Health at Home, in my city at least, has 3 different companies that they can hire home care through. So this was another company. It happened right after my surgery, and it also happened last year at my old place. We had COVID as well. And sorry, I lost my train of thought there for a second. The office is just like, oh, it's okay, they can come in still. And I'm just like, can we leave that up to them? Can we leave it up to the PS themselves who have to enter the home to decide whether or not they're comfortable coming in? Now, luckily for me, the 3 PSWs I have also gave me their phone numbers so I could reach out to them directly. So I have done that. Because if the company isn't going to look out for their employees, then at least the patient can try to. But am I wrong for doing this? Should I not give a shit? Should I just say, come on in and pretend like everything's hunky-dory fine? I think I'm doing the right thing here, and yet it's making me feel like I'm overthinking it when the company's like, no, it's fine, they can still come in, right? And I was like, no. I was like, I'm fine if they're comfortable with it, but, please let them know, because I'm not okay with them coming in blindly. I want them to know. Am I in the wrong? It's the same with why I'm calling all my appointments to be like, listen, I'm negative, but my roommate who is driving me is positive. He'll stay in the vehicle. I'll have a mask on. I will sanitize, no problem. So far, everybody's been like, yeah, that's no problem because I'm masked up, I'm negative, and I'm sanitizing, right? Maybe I'm overthinking this. I'm just trying to be considerate.